Hello, everyone. My name is Leslie Campuzano, and my program proposal is focused on mental health among adolescents, presenting to Uplift Atlas Preparatory in Dallas, Texas. My presentation link should be available to everyone once my video is done, and everyone should be able to access it. Health issue overview. Mental health is the emotional, psychological, and social well-being of an individual. From childhood to adulthood, mental health is very important and has affected the lives of many Americans for decades. About half of the people in the United States are diagnosed with a mental health disorder once in their life. Mental health overview. Some healthy mental health practices include staying positive, connecting with others, and staying physically active. Some common mental health diseases include depression, anxiety, and PTSD. Mental health has become a common illness within Americans, with 29% of people living with a mental health condition. When people are usually asked if they're dealing with when they're dealing with mental health issues, most of the time these people are unaware that they're actually dealing with mental health due to the lack of knowledge. Therefore, the focus on increasing knowledge between individuals is very important so they can be aware of their symptoms and their resources available when dealing with these symptoms. Texas population by age. On the left, it shows the 2010 population in blue, and in green, it shows the projected population in 2050 of Texas. The population in 2050 is increased a lot. On the right shows the Dallas population. The Dallas population is increasing drastically by the day, and many people are moving over here. Therefore, the health of all people is very important, and we should focus on all the healthy living, healthy living factors associated with being able to help these people and how they can reach out for help no matter what. Mental health risk factors. Individual factors include personal attitudes, motivation, for example, staying positive, activity level, eating habits. Activity level and eating habits have to do with energy levels. Energy levels are very closely related with mental health. Socioeconomic factors, poverty, resources, household income. Household incomes is very important because usually this is linked with stress, and um, people are stressed about how their how their money is going to come or how they're going to use their next check. This is very important when linked to mental health because the stress can just increase and cause a decline in their healthy daily living. Political factors, health promotion programs, health insurance, funding, how these health promotion programs are available to these people is really important, and they should be aware that they can reach out to help all the time. Health insurance, many people don't have health insurance, or they're they're in their or the funding, they're thinking about if they can afford these programs, but there are many programs that can help every single person. Social risk factors include gender, social class, race, and ethnicity. No matter who you are, race and ethnicity have to do with discrimination. Discrimination can lead to stress and other mental health risk factors. It can lead to overthinking if one is not good enough, but no matter who it is, everyone should be able to live healthy and be able to ask for help no matter what. Mental health disease statistics among Texas residents compared to the United States. Anxiety, as you can see, anxiety levels in Texas residents are very high in comparison to the United States overall. Depression levels in Texas and the United States. In Texas, it's at 15.28%, and in the United States is it is at 21%. These are still very high numbers of people dealing with depression, and the overall mental health in Texas is at 5.28, and in the United States it's at 18.57. And if mental health isn't focused on more to help these people, then the numbers will just increase, and that is something we don't want. Impacts of mental health: disability, emotional, behavioral, and physical health problems, drug and alcohol misuse, stress, and violence. Once one abuses the use of drug and alcohol, then this can be a very, very strong impact on mental health. It can cause other health problems such as um, hallucinations, depression. So these impacts should be something that these people should ask for help when dealing with it. Theory-based interventions. The first intervention is the youth aware of mental health. It was an educational strategy to promote mental health among adolescents. It was a 3-month intervention where um, there was a pre-test and a post-test to view increased mental health knowledge. The result of this intervention was that 24% there was a 24% increase in reaching out to a teacher or school staff member about depression or suicidal thoughts. Machine learning approach to understanding patterns of engagement. This was an internet delivered intervention where individuals were studied through a web platform and conducted a clinical supported ICBT, inference-based cognitive behavioral therapy for treating depression and anxiety. It focused on individual interactions of participants. They were delivered visual and textual materials and were allowed to interact and share personal stories. The result of this program was that program interactions within participants' clinical scores in, increased by a mean of 4.29 on their patient health questionnaire and a mean of 4.01 on testing for general anxiety disorder. Therefore, they were able to determine that these people needed help. And these people were aware that there was help for them and they were dealing with this. The Calm app. This was an app-based intervention focusing on sleep, a strong influence on mental health. Usually people struggling um, with sleep disorders, um, this is also an increase on mental health because it later causes stress. And um, the good thing the good thing about this app was that participants were able to mediate at least 10 minutes a day for 7 days. The intervention specialist tracked the use of the app by date, time, title, and duration. The Calm app decreased 0.3 points in fatigue, daytime sleepiness, and cognitive and somatic pre-sleep arousal, in addition to those that spent more than 10 minutes on the app and had self-reported sleep improvements. So the Mental Health Boost Program proposal. The program will use a social cognitive theory and health brief model. It is a 1-year program, and adolescents in Dallas, Texas are targeted. Program objectives. First objective is to improve the overall quality of life of people struggling with mental health. The second objective is to increase the numbers of primary care visits where adolescents are screened for depression and attend appropriate follow-up visits. Some interventions activities that will be implemented in this program are surveys. Surveys would be conducted to measure baseline mental health knowledge. There will be after school events where families can join these individuals. Doctor's visits, doctor's offices will be referred to students. Sessions, there will be 5 sessions of lectures, supporting materials, and journaling. Journaling, the people can express, they will be confidential and the people can express what they're feeling in order to receive the right amount of help. Test, there will be a final intervention test to measure improved knowledge on mental health. We'll see how their knowledge has increased and if they are aware of the help available to them. So uh, this is my program logic model. Um, what is really important about this are um, the activities were shared earlier, the short-term outcomes, midterm outcomes, and long-term outcomes. Overall focus of this will be showed in the long-term outcomes where of health, improved knowledge of mental health of participants is really important. We are focused on increased numbers of depression screening and follow-up visits. So this is highly encouraged, and this is something we want to get out of this program. And finding a primary care office to provide mental health resources and follow-ups. Program evaluation. Some questions we will be asked at the end are, were participants honest throughout the activities and practices to improve individual health? It's very important for participants to be honest in order to find the right amount of help they need. Was the program executed properly? Was there something that needed to be changed? Did the educational activities keep the participants involved? Do participants feel more comfortable reaching out for help when dealing with mental health issues? And the very important question for us to ask is, did the program increase mental health knowledge overall and make a positive change in the future of participants? Because we are very focused on the future of participants and how healthy they will be. Conclusion. Mental health among Americans has been a problem for decades that people struggle with daily. It has cost about 225 million in healthcare costs in 2019, which is about 52% more than 2009. Several programs have been implemented to improve this problem, but the targeted population has a lot to learn about mental health and resources available. Mental Health Boost is a proposed program intervention explained to improve mental health knowledge and encourage individuals to visit primary care locations for checkups and follow-ups. So we want these individuals to reach out to primary care locations and um, after they reach out to have their visit and go to their follow-ups to see if their health is improving. So it is very important for us to be focusing on their overall mental health knowledge and make sure that if they are struggling with mental health to get the help needed. So this is my proposed program. Are there any questions? If there are any questions, please feel free to email me at lcampuzano@leomel.tamuc.edu. I thank you for taking the time to listen to my program, and thank you for being able to. I hope everyone enjoyed my program proposal and hope we can all work together to improve this problem to help every person dealing with this. Thank you for taking the time to listen to my presentation, and I hope you all have a great day.